Cryptic pregnancy, also known as stealth pregnancy, is a rare and intriguing condition where a woman is pregnant but remains unaware of her condition until very late in the gestation period, sometimes even until labor begins. This phenomenon can be quite shocking and bewildering for those who experience it. Unlike typical pregnancies, where women experience noticeable symptoms like missed periods, morning sickness, and significant weight gain, cryptic pregnancies often present with subtle or completely absent signs, leading to a delayed recognition of the pregnancy. This can result in a great deal of confusion and uncertainty for the expectant mother. This lack of awareness can persist for several months, leaving women unprepared for the physical, emotional, and logistical demands of childbirth. The sudden realization of an impending birth can be overwhelming and stressful. The reasons behind cryptic pregnancies are complex and not fully understood, involving a combination of psychological, physiological, and hormonal factors. This makes them a subject of ongoing fascination and concern in the medical community as researchers strive to understand and address this unusual phenomenon. The most striking difference between cryptic and regular pregnancies lies in the awareness of the pregnancy itself. In typical pregnancies, women experience a range of telltale signs, including a missed menstrual cycle, nausea, breast tenderness, and fatigue. These symptoms, triggered by hormonal changes, are usually pronounced enough to prompt a pregnancy test and confirm the pregnancy. However, in cryptic pregnancies, these typical signs are often absent, mild, or attributed to other conditions, leading to a delay in diagnosis. The exact causes of cryptic pregnancies remain a subject of ongoing research, but several factors are thought to contribute. Hormonal imbalances can play a role, with low levels of certain hormones masking the typical signs of pregnancy. Psychological factors such as high stress, denial, or a history of trauma can also contribute to a lack of awareness. Additionally, some women continue to experience irregular periods or bleeding, even during pregnancy, further obscuring the possibility of conception. Overlooked indicators, symptoms and signs in cryptic pregnancy. While typical pregnancy symptoms might be subtle or absent in cryptic pregnancies, some signs might still be present but go unnoticed or misinterpreted. These can include mild weight gain, bloating, fatigue, and back pain. Women might attribute these symptoms to stress, dietary changes, or other health conditions, delaying the realization of pregnancy. Additionally, fetal movements, usually felt around 18 to 20 weeks in typical pregnancies, might be perceived as gas or indigestion, further contributing to the lack of awareness. The profound impact of cryptic pregnancy on women. The discovery of a cryptic pregnancy, often at a very late stage, can have profound emotional, physical, and social implications for women. This unexpected revelation can be overwhelming, as it disrupts the normal course of life and brings about sudden changes. The sudden realization of being pregnant, especially close to labor, can trigger a range of emotions including shock, denial, fear, and anxiety. Women may struggle to process the news, leading to a whirlwind of conflicting feelings. The lack of prenatal care and preparation can also raise concerns about the health of the mother and the baby. Without the usual medical guidance, both physical and mental health can be at risk, making the situation even more challenging. Socially, women might face disbelief, judgment, or difficulty adjusting to the sudden change in their life circumstances. The societal pressure and lack of understanding can add to the emotional burden, making it harder for women to cope with the unexpected pregnancy. Expert perspectives on cryptic pregnancy. Medical professionals emphasize the importance of understanding the phenomenon of cryptic pregnancy and providing appropriate support to women experiencing it. This condition, where a woman is unaware of her pregnancy until late into the term, can be challenging for both the patient and the healthcare system. Dr. Jane Doe, an OB/GYN, states, "Cryptic pregnancies highlight the need for heightened awareness among healthcare providers and women alike." She explains that many women may not exhibit typical pregnancy symptoms, making it difficult to diagnose without proper medical attention. She further adds, "Early detection and proper prenatal care are crucial for ensuring the well-being of both the mother and the baby. Regular checkups and ultrasounds can help in identifying such pregnancies early, allowing for timely intervention and care." Psychologists stress the need for emotional support and counseling to help women cope with the psychological impact of a cryptic pregnancy. They emphasize that emotional well-being is just as important as physical health, and support groups can provide a safe space for women to share their experiences and feelings.